So the next troubleshooting I look at is the patient comes in and they have shin pain. There's 5 things I look at. First of all, make sure they put the brace on. Proper application is a big thing. They can be putting the hinges too far interior. They may not loosen number 5 strap. The tibia groove on the liner is not lined up with the tibia properly. If those don't happen, then we can look at maybe there's too much correction in the brace or the active thigh is too short. So first thing is proper application. Patients again are overwhelmed when they get fitted with a brace, so they tend to put the brace sitting too anterior at the knee. You have to make sure the brace sits back as far as possible. Easiest way I do it is that when I put it on a patient's leg, the condyle pads at the knee, I want them to sit back as far as possible on the leg, okay? How do I do that? How do I know if they're back far enough? If I can't see underneath the condyle pad, the brace is sitting back far enough. If I can see underneath the condyle pad, that means it's sitting too anterior. So what happens is with the hinges sitting too anterior this way, this cuff is now angled into the shin and they're going to get shin pain. So by bringing the brace back properly, we'll bring the cuff more flush against the shin. Okay. Second thing is, if they do not loosen number 5 strap. A lot of patients will not loosen the front strap when they take the brace off. It's very important for that to happen because if this number 5 strap is too tight, what happens then is the hinges will shift anterior. So we're in the same effect if they don't apply it properly, that now the tibia cuff is going to dig into the shin. So always make sure they take off the front strap. And you'll notice that when you have them put the brace on, if they're doing that or not. Okay. Third thing is the tibia groove. Now, the tibia groove on the liner is designed to line up with the tibia crest. If it doesn't line up properly, when the patient gets up to weight bear, if that groove isn't sitting in the proper position, they're going to get shin pressure. So what I do is I put the brace on, have the patient get up, walk around, check to see if that is lined up properly. If it isn't, what you need to do is sit them back down, take the brace off, move the liner to the position where it's now going to have the tibia crest in the proper position. So remember, do that when they're weight bearing. The thing is, when you're sitting versus when you're standing, a lot of these patients have a lot more rotation in their knee. Check it when they're standing versus when they're sitting. If it lines up, that will take a lot of pressure off, okay? If those 3 things don't solve it, then what you can do is now, when you apply the brace, the patient applies the brace, tighten the 5th strap when the brace is on. Now, the 5th strap, when you tighten it, will help pull the cuff away from the shin a bit. You don't want to pull it too much because that'll affect the function of the brace, but pulling it a little bit will help relieve pressure on the shin as well, too. The other thing can happen is that the active thigh may be too tight on the thigh. Now, what happens is if you see the active thigh and it's tight at the bottom, but there's gapping on the top, that means it's too tight. And what will happen is the brace will tend to want to position itself so these become flat, and then the hinges shift too far forward. Same thing again. If they shift too far forward, it's going to cause shin pressure. So what you need to do is you need to open up the active thigh. So how you do it? The 2 straps are adjusted at the bottom. You take the liner off inside. You have your Allen key. Take the screw out, move it over 1 notch. Open it up 1 notch, and that's on both sides. That should be enough. When you reapply it, you'll see that the active thigh is sitting flush and that you won't have any shin pain from that. Now, the last thing is, if the patient is still getting shin pain, it could come down that there's just too much correction built into the brace. This is somewhere you definitely want to go back. If you are a patient doing this, go back to the fitter and have them adjust it. But when we put correction into a brace, it's a 3-point leverage. So when they put weight down, there's a force going here, here, and here. So if there is too much correction, that force here will cause pressure on the shin, especially from the medial side of the shin. So what can happen is we can take off correction. 1 degree turn, Allen key takes off correction. They can do it weight bearing, and they'll take some pressure off the shin as well. Like I said though, if this is a patient, do not adjust this. Go back to your fitter, have them adjust it properly. Even the active thigh adjustment, I would recommend to go back to the fitter, have them adjust it. All the other situations you can adjust on your own.